probably won't pick up. It won't pick up the same. Come in.
Hi, my name is Will. I'll be your nurse for today. Can I have your name and date of birth?
Yes, Rose Vanda Lindor, 12/23/1998.
Thank you. So the reason I'm here, I'm just gonna do a quick assessment. Can I have or do you have any allergies that you know of?
No.
Okay. So like I said, just here to do a quick assessment. It should take about 20 minutes, okay? So I'm gonna go ahead and wash my hands and I'll provide some privacy for us. And I'll gather my supplies. And I'm going to start by checking your vitals. So, are you having any pain right now?
No.
There we go. Okay. Which arm do you want me to use?
Whichever one is fine.
I'll use this arm here. And I'm going to bring the bed up a little bit. 'Alright, I've got 118/76. That's normal. Put that back here. And go ahead and place this here. And I'm going to check your temperature. Have you open? .9 for your temperature. That's good. And I have 97 for your oxygen, 99 for your heart rate. Right, I'll take this one off. And I'm just going to go ahead and feel your pulses here. All right. They are equal, and I would say bounding. All right, I'm going to move up and feel right up here. All right, and your brachial pulses are also equal. And I would say +2. And for your respiration rate, I've got 17, okay?
Okay.
All right. So I'm going to bring you down a little bit. All right, and next we're going to go ahead and check your cranial nerves. So I'm going to start by having you close your eyes. And I'm going to bring this to your nose, and you tell me what you smell.
Okay. You want to do it again? Sorry. Yes, alcohol.
All right. And you can go ahead and open your eyes. So now I'm going to go ahead and assess your second cranial nerve, and that's your vision. Do you have any changes with your vision?
No.
No? And you're following up with your eye doctor?
Yes.
Okay. And no blurred vision, no changes, anything like that?
No.
No. Okay. Now we're going to go ahead and do cranial nerve 3. And that's going to check for your vision too, your cardinal fields of gaze.
Okay. You need me
And
to take my glasses off?
yes, please.
Sorry.
So I'm going to go ahead and shine this light in your eye.
Okay.
Just go ahead and look straight for me. All right, so your pupils are equal in size, round, and reactive to light. All right, so I'm going to go ahead and have you follow the pen. All right, and next I'm going to have you follow the pen with your eyes, okay? All right, good. And now I'm going to go ahead and assess your cranial nerve number 5. So I'll have you go ahead and close your eyes and tell me where you feel this tissue feel you. Okay.
Forehead. Cheek. Left one. Right cheek.
Okay. And I will check for your cranial nerve number 6. I'll have you look at me. And can I have you smile? Show me your teeth. And can I have you puff? Raise your eyebrows. All right, so it looks to be intact. All right, now we're going to check your cranial nerve number 8. I'm going to go ahead and we're going to check your hearing. So I'm going to come behind you and I'll have you cover one ear. And I'll have you tell me what you hear. 5.
5.
Now we'll do the other side. Same thing. 6.
6.
Good. All right, now we're going to assess for cranial nerve number 9. Have you had any changes in your taste of
No.
and change in taste?
No.
No? Okay. And we'll do cranial nerve number 10. Any trouble with swallowing?
No.
No. Eating?
No.
Speaking?
No.
All right, and we'll do cranial nerve number 11 now. So I'm going to place my hands on your shoulders. Just go ahead and shrug for me. Good. One more time. And I'm going to place my hands on your head here. Go ahead and turn. Good. And finally, we'll check cranial nerve number 12. Can I have you stick your tongue out and move side to side? Good. All right. That's all the cranial nerves, and they all appear to be intact, okay? No abnormalities. All right, so from there, now I'm going to go ahead and palpate your lymph nodes. I'll start with the preauricular here. We'll go postauricular, occipital, jugulo-digastric, submandibular, submental, the deep cervical chain, and then the supraclavicular. And I they're non-palpable, which is normal. And good. Now I'm going to go ahead and listen to your, or actually, we'll start with, I'm going to go ahead and feel your carotid pulses here. We'll do one at a time. We do one at a time so so blood flow doesn't cut off and you pass out on us. All right, so that one's palpable. Same with this side. All right, and I'm going to go ahead and clean my stethoscope one more time. Now I'm going to listen to your carotid for any bruits. All right, that sounds good. And all right, so now I'm going to go ahead and have you lie down for me. Yeah. All right, and in this section, I'm just going to go ahead and look at your chest here, listen to your abdomen, and then we'll move down. So I see that you have normal chest expansion. There, you're not having any trouble breathing. And yeah. So now I'm going to go ahead and listen. So I'm going to start with your aortic. Which is right here. Now we're going to do your pulmonic. We're doing Erb's point now. Tricuspid. And mitral. I'm going to go ahead and listen for a minute. All right, so I've got 80 beats, and S1 and S2 where I could hear S1 and S2. Those are the normal heart sounds. And if I were to assess for murmurs, we would have you check those 5 locations with a bell, and I'd have you sit, lie, and on your side. Okay? But we're not doing that today. All right, so now we'll go ahead and move down to your abdomen here. So I'm going to go ahead and take a look, and then I'm going to go ahead and listen, and then we'll take I'm going to percuss and then palpate. All right, so is it okay if I pull up your shirt? All right. How's your bowel movements? Have you had any changes?
No.
Okay. When was your last bowel movement?
Today.
Okay. Any trouble with that?
No.
Any problems with urinating? No. Any changes in color? No. Okay. So the abdomen appears to be symmetric, no lesions, wounds, or abnormalities, no discoloration. That's good. And now I'm going to go ahead and listen really quick, okay? All right. So all the vowel sounds were present, normal, active. That's good. And now I'm gonna go ahead and listen again. This time I'm listening for any Bruids. Okay. Same thing. So now I'm gonna just. Right. All right, that's good. And now I'll go ahead and lightly palpate or percuss, and you. What we want to hear is timpani, and that's what we hear. So that's good. And I'm gonna lightly palpate. Tell me if you feel any pain. Are you having any pain right now?
No.
Okay. Is that okay?
Yes.
All right. Now we're gonna go. We're gonna go a little deeper. And we're going a little deeper to see if we feel any enlarging in the organs or any abnormalities. Did you feel any pain?
No.
Any tenderness? No? Okay, we can go ahead and pull this down here. I'm going to move down lower. I'll go ahead and put my gloves on. I'm going to wash my hands one more time. So feel for femoral, present, and then I'm going to go ahead and pull your pant leg up. We're going to feel for your popliteal, which is your pulse behind the knee here. All right, and it's palpable. That's good. All right, and I'm gonna come down. I'm gonna feel for your tibial. Posterior tibial. And we're doing dorsalis pedis. And they're palpable. +2. And we're gonna check your strength. I'm gonna go ahead and have you push down on my hands. Pull up on my hand. Good. I'm gonna check your cap refill. That's good. So less than 2 seconds. That's good. And I'm going to check for your skin turgor here. That's also good. All right. And I'm going to go ahead and have you bend at the knee here. Good. Now we're going to do this other one here. Good. All right. And then I will and wash my hands one more time. And we'll bring these down. I'll wash my hands one more time. I'm going to go ahead and have you sit on the edge of the chair here or bed. All right, and I'm gonna do the same thing with your hands. Can I see your hands? I'm gonna check your cap refill. Same thing here. Good. And I'll check your skin trigger. Good. And now I'm going to check your strength, your grip strength. So just go ahead and squeeze my 2 fingers here. Good. So +5 on your strength there. And finally, we're going to check your balance. So I'll have you step up and have you stand right there. I'll have you walk towards me. All right. And your gait appears to be normal. Good. And we're going to check your, can I have you stand over here? Can I have you stand on one leg? Good. And now do the other leg. So balance is good. And I'll have you turn around for me. I'm going to go ahead and check the head and the spine here. And they appear to be symmetric and in line. I don't know any lordosis or kyphosis. So that's good. And you can go ahead and have a seat. And I will bring your bed all the way down, bring your table, and bring your call light. Do you have any questions for me? Okay, so that concludes our assessment. Okay, thank you.